Hi, class. This is the end of work week 9, race and class, which seems kind of an apropos as we are standing on the eve of the election. This election has brought about a lot of conversation around race and class and privilege. So it seems important that we're having this conversation now. So the question was asked about your racial identity. We do know that race is a social construct. There is no biological basis for it. It was used to categorize and to separate people, and it continues to be used in that same way. Nevertheless, it is a reality in this country, particularly felt by people who are of the non dominant race. Um, so it is important we have this discussion, particularly as it pertains to children and how they develop a sense of identity. But before we do that, I do want to share with you my background. I am African American. Both my parents are African American, and their parents migrated from the South during the Great Migration, where many, following slavery and the Reconstruction period, many African Americans moved to the northern cities. And so that's how my family arrived here. They are working class. In fact, it was interesting. It was my father, who is a well known artist, who separated from his family to come to New York, was married, and had me and my three brothers. And so I have privilege by virtue of the fact that um, we are upper middle class. We're definitely not in that 1%, but in terms of opportunity, there was nothing that I ever lacked for or nothing ever needed. And it's interesting, as such, I went to predominantly white schools and white colleges and never actually thought a lot about race. I mean, obviously, I knew I was African American, but I always felt that I could be and do everything that I ever wanted to do. And it's been in this last 5 years with the rise of discussions around race and the Black Lives Matter that I've begun to do even more kind of research and studying and understanding how both race and class, because often they intersect, impact people, and particularly children. And now, where I'm raising a granddaughter, and she's asking questions about race, and trying to understand some of the things that are being said. Although I try to block a lot of it from her, she hears things. There's constant dialogue and conversation around race, and around class, particularly around this election. So helping children understand, first of all, before we can help them understand, hence the question I asked, what is your racial identity, is that we do need to understand ourselves, and how we have experienced the world before we can begin to understand that not everyone's experience is the same. And even though this is, we often hear the melting pot, and that America's colorblind, in reality, we are not. And I don't think there's probably any country in the world that is actually truly colorblind, where everyone is judged by the content of their character, sorry. But it is a reality. And so, in working with kids and families in healthcare settings, being aware of the messages that they are receiving, being aware of the questions that they have, are very, very important, and acknowledging that they do exist. I think probably one of the most hardest things is when people tell you it's in your mind, it's in your imagination, that we see all people the same. Some of you mentioned in your post, being or hearing medical staff talking about groups of people and categorizing groups of people. This is something you will continue to hear. I think it's also on the tip of everyone's tongue, particularly as it had dominated the news media in the last few years. But how can we, as child life specialists, support all kids and families? And I think it's understanding that it does exist. Looking at what we have in terms of materials, yes, dolls, yes, books, yes, movies, but in addition to that is that we hear their concerns and their feelings about the healthcare environment, which are very much tied to class and tied to race. Also, being able to speak up when we hear people say disparaging things about other groups of people. So the more we learn, the more we know, This is very hard work. You'll often get or hear the word privilege. You'll often hear the word about microaggressions, which are those day to day little chips, ways in which people say things that kind of chip away at your sense of self. And I'll give you a good example is I will often have people say, well, Troy, I don't think of you as black. And at the time, they're actually believe they're giving me a compliment. But I am black and I am proud to be African American. So to say I don't see you as black means exactly what? I have not asked. The next time that someone says that, I am going to dig a little bit deeper. But there's those kinds of things that are said that are not meant to harm, but chip away at the sense of self. So I would encourage you to continue to reading, continue to view videos, continue to build your skills. Cultural competence is often what you'll hear it referred to in a healthcare setting. There's a lot of information out there on the Patient and Family Institute website. There are a number of websites that have been posted, and some of you have posted websites. Continue to do so. This is work that continues to need to be done. And I think, if nothing else, this election period has really taught us there are a lot of biases out there. There are a lot of issues out there